Hello, everyone. A very good afternoon to you all. Myself, Dr. Sumedha Gupta, and on behalf of Voice of Healthcare, I would like to welcome all the viewers who have joined us today. So, today we are here for an insightful session on the topic Heroes Fight for Health. Join the Prostate Cancer Awareness. And I would like to mention that this initiative is supported by Zydus Life. So, as of the latest data, prostate cancer is one of the most common cancers among men in India. According to WHO, prostate cancer accounts for approximately 11.6% of all the new cancer cases in Indian men, reflecting a significant increase in incidence over the recent years. This estimated number of new cases is around 60,000 annually, with a noticeable rise in diagnosis, which actually due to improved awareness and screening practices. However, despite advancement in detection, the mortality rate remains a concern, emphasizing the need for enhanced care, public health strategies, and early intervention measures. And in light of these stats and facts in this session, we are going to discuss about the holistic prostate cancer care by integrating physical, emotional, and psychological support. To begin with the discussion, first I would like you all to join me in welcoming our experts who are going to provide us with insightful information on understanding about the prostate cancer and its awareness. So I would like to welcome Dr. Bharat Bhosle, Senior Consultant, Precision Oncologist, Bombay Hospital, Mumbai, Sir H. N. Reliance Foundation Hospital and Research Center. Good afternoon, Doctor. Welcome to the discussion. Moving ahead, I would like to welcome Dr. Santosh, Senior Consultant, Medical Oncologist, Star Hospital.
Thank you.
He'll be joining us in few minutes. Now, I would like to welcome Dr. Sainath, Senior Consultant and Head Department of Medical Oncology, Star Hospital, Hyderabad. Moving ahead, I would like to welcome Dr. Fahad Afzal Shaikh, Medical Oncologist and Hemato Oncologist, Jaslok Hospital and Research Center in Mumbai. And, and I would also like to welcome Colonel Ajai Tomar, CEO of Indian Cancer Society.
Namaskar.
So let's delve into the discussion. To begin with the discussion, first I would like to ask Dr. Santosh that what are your views on specific elements that should be included in the comprehensive prostate cancer care plan to ensure it addresses physical, emotional, and psychological needs of the patient very effectively?
So, a very, very relevant question. It might be applicable to all the cancer patients. The main thing is whenever the diagnosis of cancer occurs, it creates an emotional panic among the patient and the family members. So, apart from addressing the medical needs, non-medical needs becomes very, very essential. As far as medical needs arises, we need to look over all the domains of multidisciplinary care in the form of urology, surgical oncology, medical oncology, radiation oncology, along with two important players of the team, that is pathologists and upcoming, especially molecular genetic people. And very important people, according to me, are the dietitian and also physiotherapist. Because during the treatment of prostate cancer, a lot of issues do arise in form of sexual health, urinary incontinence, and also loss of fatigue and everything. So we need to have a psychosocial evaluation upfront. We have to form a team and address the all the issues regarding to the complaints or the medical needs and also the non-medical needs, the emotional aspect, and also if there are any clinical trials or patient assistance program, we have to support them emotionally and also financially. So, according to me, this is a wholesome treatment that is required in management of a patient with prostate cancer.
Thanks, Dr. Santosh, for your insights. Since you mentioned about the physiotherapist and other treatment options. So I would like to ask Dr. Sainath, like in your view, how do multidisciplinary team coordinate care for prostate cancer patient and what benefit does this collaboration bring to the patient outcomes in terms of treatment?
So it has been a well-known fact across the world that best of the treatment outcomes come when the patient is treated through a multidisciplinary team of specialists. So prostate cancer, like Dr. Santosh said, it's always a multidisciplinary care. So, right from the point of diagnosis, where you have to involve your urologist and pathologist to get the biopsy and to read the biopsy, to look at, now we have a lot more histological classification, as well as the molecular features which needs to be checked. So, right from there to the treatment planning, especially in the localized prostate cancer, where you decide which would be the best approach, the side effects, the even the survivor issues, the long-term issues, and what the patient wants. And ideally, this is a disease of men. So, we should mentally prepare and give the options to the patients, the pros and cons of each modality of treatment, and ultimately enable him to give the right information so that he can make a choice. And to give that, you need specialists of each field to elaborate how we are going to handle the side effects part, as well as what would be the best way to go without compromising on the outcome. So that's the reason a multidisciplinary team of specialists managing a prostate cancer is very, very important. And really, it helps the patients in addressing all the needs. It's not only the tumor part, it's also the toxicity profile, as well as the psychosocial aspect, as well as what to expect.
Thanks, Dr. Sainath, for such information. Moving ahead with the discussion to Dr. Fahad, in your view, what are the most pressing gaps in prostate cancer awareness in India today, and how effectively we can address these gaps to improve the public knowledge?
Hello. So, in a country like India, prostate cancer awareness faces several pressing gaps. The first and foremost is the lack of knowledge. Many men and sometimes even healthcare providers are found to have limited awareness about prostate cancer, its symptoms, the risk factors. And hence, it is very important for us to educate them by awareness programs, etc. Secondly, there's cultural stigma. Discussions about the male health, especially those that involve the male sexual health, are often taboo, and that hinders the open conversations about prostate health. We also have limited screening facilities. Even a basic blood test like a PSA can be difficult to do in a rural area. We also have a lot of misconceptions in the society regarding prostate cancer. Some deem prostate cancer to be a Western disease, and that also leads to complacency among the Indian men. So I think by organizing public awareness campaigns, utilizing social media platforms and community programs, engaging in workshops and seminars at the local community level, training healthcare providers in identifying or detecting prostate cancer, managing it, counseling it, tying up with NGOs, partnering with NGOs can also help the awareness reach even the marginalized populations and enhance the education efforts. So by addressing these gaps, then we can improve early detection and eventually treatment outcomes for prostate cancer in India.
Thanks, Dr. Fahad, for such insightful information. Moving ahead with the discussion to Dr. Bharat, I would like to ask what are the best practices for the caregivers to manage the emotional, physical, and psychological demand of supporting the person who is suffering from the prostate cancer?
So, very good question. So, most of these starting statement by Dr. Santosh, where no multidisciplinary team is involving, radiation oncologist, medical oncologist, and a surgical urologist. Each patient usually start from the surgeon who are urologists. What is more important, the multidisciplinary treatment is involvement of a person who is called as a counselor most of the time. These are sometimes social workers who are sitting over there, psychologists with a psychological background. They are not psychiatrists. So acceptance of the diagnosis is very important, because most of the time what happens in India, people come with the patient, but they don't want the patient to know that the patient is suffering from cancer. This is not for prostate cancer overall. And this is a misconception. By not telling the patient, see, sometimes patient come to Tata hospital and the still relative don't want to tell the patient that they are suffering from cancer. So they are actually damaging over here. Sometimes the cancer has a low profile or no, a curative intent or a biology which doesn't mean that patient is going to die tomorrow. But hiding something from the patient creates a psychological distress inside a patient. So caregiver first needs a education how to break the bad news with the patient. Obviously, no physician intend to tell the patient you have a cancer and no directly. It's a stepwise a discussion with the patient. But the caregiver first needs to educate them that telling the patient in a way that patient's mindset become positive is very, very important. That is all cancers, not only prostate cancer. Now coming to prostate cancer, it's a cancer of old age. Sometimes you have a patient who is 90. Sometimes we have younger patients at the age of 50 also, or below 50 also we have seen, but this is a rare scenario. But largely it's a geriatric problem, geriatric age group problem. In India, the number of geriatric patients is increasing day by day with a good support, healthcare support we are providing. And the number of prostate cancer cases we are going to see in the future is big. In prostate cancer, fortunately, the treatment is androgen deprivation therapy in the form of, removing the testes, which is called as a orchidectomy by a surgeon, or giving some injections, which are hormonal injections. And largely, that has been the backbone of treatment for advanced prostate cancer, to the extent for locally advanced and surgery for earlier cases. Now, the radiation is also equally effective, like removing the prostate. There is an alternative of giving a precise radiation. Now, all these options, when are put in front of a patient or caregiver, the patient or caregiver both gets confused. So, how to communicate with them is a bigger challenge. So, multidisciplinary team, what Dr. Santosh has rightly mentioned, does a good job, at least getting a best possible treatment to the patient and guiding them, just trying to help them to choose the best. Obviously, we don't tell them to do surgery, we don't tell them to do medications. All these options nowadays, fortunately, in last decade, 10 years back, there were hardly any options for prostate cancer patient. And suddenly, in the period of 10 years, you have multiple options of chemotherapy, multiple options of hormonal treatment, and there are many options now in the nuclear medicine where you can do precise radionuclide therapy. So then, if you provide all these treatments, you have to guide the patient. And the best person is caregiver. Now, apart from the treatment, how to sail through this treatment? Because these patients are not the patients who are not going to have only 6 months. Some of the patients with the prostate cancer live beyond 10 years. And again, as I told you, these are the patients who are in their 70s and 80s. So apart from the cancer, they are already dealing with hypertension, diabetes, heart problems. So they are already on polypharmacy. Some of the patients are dealing with dementia, forgetfulness, right? So it is the caregiver who plays the very, very important role, right from taking decision, deciding which treatment to choose and how to handle the side effect of these treatments. So they need to have education about the side effect of each and every treatment. Now, for every simple thing, though, sometimes they may not be able to approach the team. There are doctors in the hospital and the paramedical staff. But then if you educate them through a group of people who are suffering from the similar problems like prostate cancer, there are groups of patients we create in our hospital or in a community which support to take discussions. So that helps to deal with the problem of accepting the diagnosis. Sometimes it helps to deal with simple problems of taking decisions, which drug to take, from where to take. For every simple thing, they need not go to the hospital. So there are support groups, psychological counselors. I think that is the most important, right from the diagnosis, selling through the treatment, going through the palliative part. So that is very, very important. And beyond that, what I feel, caregiver should know, most of the time we have family physicians. So now India is also coming with the concept of family physicians. We must, all of our physicians must incorporate the family physicians who are near to the patients, who sometimes take a decision. Or in Mumbai, at least, many times family physicians are involved. So we have to involve them also in the treatment as a support to the caregivers. So yes, there are needs to educate the caregivers, but caregiver is the person who actually plays the very, very important role. Not only decision making for the treatment, but also handling the psychological aspect. And now there are many psychological aspects. Now my colleagues can add how they deal with this. But I feel caregiver is the main person who can take a important role, and actually it can translate into better survival and quality of life more than the survival.
Thanks, Dr. Bhosle, for such an insightful information onto that. Moving ahead with the discussion to Colonel Ajai Tomar, I would like to ask, how can public health initiatives more effectively address the stigma and misinformation surrounding the prostate cancer? Uh, Please unmute your mic, Colonel Ajay. Yep.
There are a lot of misconceptions which surround not only prostate cancer but other women cancers also. So, like Dr. Bhosle had said, an earlier speaker, Dr. Santosh had said that awareness plays a very important role. Our campaigns should be very, very sensitive because these are gender sensitive diseases. For prostate, it's male. For cervical, it's women. So it should be very, very, our campaign should be very, very sensitive. And how it can be done is by messaging through social media, through TVs, through influencers, and through so many other media, that is the government agencies, the NGOs, they should all get involved and remove all these misconceptions about prostate cancer. That if prostate cancer occurs to you, this will happen or that will happen, you'll become important, and things, those misconceptions should be removed. And like messaging, when COVID came, so simple methods of using messages were very, very frequently used. So in the local lingo, messages can be sent out. And then another thing is using the sarpanches. उधर होता है in villages, people get together on particular days and they speak to each other. So the panchayat should tell them about, you should have an open discussion. Idea is, don't have it as a closed discussion क्यों हो इसको ये हो गया वो हो गया. You have open discussion and remove all these myths and misconceptions. Social media, of course, nowadays a lot of people, they are involved in social media, influencers, micro influencers, and then should have uh, something like these which we have in Indian Cancer Society, leaflets. These education is best provided through these leaflets. Once you are having awareness talk, distribute these leaflets, and then once they go through that, you then come to the next stage of getting the screening done, whether it be through government, whether it be through NGO. The next step after awareness is get the screening done. And once the screening is going on, encourage people to come forward for screening. Like when we do for head, neck, oral, and gynae cancer and prostate cancer. So once there's a crowd, once they see a mobile van standing there with a lot of doctors, people automatically come forward. So just awareness won't help. You should have the facilities to also provide and clear all these myths. Then TV, like I've already covered. So these are some of the measures at national level which we can take, and at micro level which NGOs can take, the government health providers can take, ASHA workers. So that's it. I think I hope I have cleared the question, answered the question.
Thanks,
Yeah, very
Colonel
important
Ajay.
point. That's very important point. I guess. No, simple methods can be utilized for awareness.
Yes, simple, absolutely simple methods.
Moving ahead with the discussion to Dr. Santosh, I would like to ask, how can educational programs be designed to improve prostate cancer patient in terms of understanding their condition and the treatment options?
Yeah. So many people have a conception, and as a matlab, increased awareness during annual health checkup. So many times they get PSA testing also. Many assume that elevation of PSA is equal to cancer. So many scenarios, it could not be a cancerous condition. This is where a lot of people become panic. So we need to explain the normal physiology of the prostate gland. As age increases, the size of the prostate gland increases. And in many cases, it's a non-cancerous condition, benign prostatic hypertrophy, that we need to differentiate from cancer. Along with sometimes even urinary infections also might cause this elevation of pH. So this part should always be like a pre-test uh, phenomena when they are going annual health checkups, especially these tumor markers. Randomly, they get this tested done. This is first thing that needs emphasis. So this can be done across various channels, as your organization, Voice of Health (VOH), is doing a fantastic job in arranging an awareness on prostate cancer. Similarly, short kind of where with growing the millennium and generation, the attention span is less. So creating short content in the form of reels and creating short questions and answers to that, that should create awareness. This is one thing. And also having pamphlets and information leaflets, as Colonel Sir has said, so that would also widely increase the availability. Third is utilization of the media, so both the print and electronic media, to send an awareness among common questions. That is, they ask if PSA is elevated, what should be done, and along with that, utilization of various channels in the form of railways or aeroplanes. Whenever we print the boarding passes, do something in terms of prostate cancer, so it would be reachable to wide gamut of people. And panchayats are very fantastic, especially in rural setup, where we can provide them with proper information. These all channels should be focused in diagnosis of prostate cancer and treatment of prostate cancer, so that there would be aware of many people. So why the tests are done, and also many people are not aware of what is a confirmatory test for cancer, and also what is the staging of cancer. Simple illustration by one to cartoons would tell them that what is the diagnostic confirmation and what is the stage of cancer. According to me, short information which is very crisp, which requires little attention for the people and easy to understand in their own languages. It's very important that the content, the information reaches to the native people in their own language. So these are the things, according to me, should be done so that the information is dispersed across all the population from the rural to the even the urban class.
Thanks, Dr. Santosh, for this wonderful explanation. Moving ahead with the discussion to Dr. Sainath, what psychological challenges do prostate cancer patients frequently face, and what approaches are the most effective in providing mental health support to such patients? Dr. Sainath, you are not audible to us.
Am I audible now?
Yes, yes, you're audible now.
Yeah. So, the most important giving cancer treatment, not only in prostate cancer, in any cancer as well. So here, if at the outset the scenarios, the clinical scenarios also vary. So in a patient who has a metastatic or a stage 4 prostate cancer, the psychological effects or the challenges are different. Here, Dr. Bharat has said, this is mostly a disease of geriatric population. So the biggest challenge is in our setup, people fear the treatment more than the disease. So they come upfront with a lot of prejudice, saying that I wouldn't like chemotherapy, I wouldn't like this kind of treatment, radiation or surgery or anything. The first important thing is to allay their fears about the treatment. I think that is the important challenge we as a clinicians face, and also the patients go through a lot of anxiety related to the treatment. So reassuring the patient and the family that we all are on the same page when it comes to quality of life as well as managing the toxicity of the treatment actually goes a long way in during the treatment at the different stages of treatment in a stage 4 patient. Whereas in a localized prostate cancer patients, where we give a lot of hope that this disease can be cured and you are likely to be free of disease, two important psychological challenges arise post treatment. One is the sexual dysfunction, and the other is the urinary dysfunction. So, making aware of the side effects prior to the treatment and also the options to deal with them helps in a long way. And like Dr. Bharat rightly said, involving the caregiver in the treatment, especially even in these settings, helps a lot, especially in addressing the psychological needs of the patient. And apart from that, we do have clinical psychologists and palliative care specialists who are also a part of the multidisciplinary team to help them, manage the anxiety issues and the sexual health and urinary incontinence related psychological issues. Apart from the pharmacological and the non-pharmacological therapy, which are there to treat these conditions.
Thanks, Dr. Sainath, for these insights. Moving ahead with the discussion to Dr. Bharat, I would like to ask in what ways can family and friends enhance the support network for prostate cancer patient and what specific role should they play in the whole care process?
So nowadays, lot many support groups, or WhatsApp groups. Like, we have our WhatsApp groups for our college friends, or societies, or alumni of medical oncology, surgical oncology. Likewise, patients are also forming their groups, and with the help of treating physicians or surgeons. And it's a good that they are communicating with each other. But it is very, very important for us to keep a right discussion, because sometimes you have a patient who is in the terminal phases of palliation and some patient who is early part of diagnosis. The right communication needs to be there, and it is always our responsibility to guide them to have a positive discussion, but right discussion. In the sense, you can't tell a palliative patient that you have so many years and these many treatments, but at the same time there are curative patients who needs to know all the options. So these support groups needs to discuss right points. The queries, simple queries I earlier mentioned, can be discussed. So when they come to a physician or surgeon or a radiation oncologist, they put up no right question in front of the treating clinician and get the right answer, or that consultation period needs to be utilized properly to take an informed decision. That is very, very important. So I look at support groups that they should give a proper knowledge, at least for supportive care. Which supportive care is apart from what we treat as a surgery, radiation, and chemotherapy, what side effect comes. Right from simple nausea, there are treatments which needs to be discussed, what medications to be taken. On the counter in India, there are too many medications. There are alternative sciences, alternative therapies which are available. But right therapy should be chosen. Obviously, you have alternate therapy. I earlier mentioned you have musical therapy. Yes, it is cost effective to reduce the psychological impact, putting positive. But there are alternative drug therapies. Whether they are right or wrong needs to be discussed in forum, and then these people can come to us and they can put up their question. As I mentioned, there are so many therapies coming up in prostate cancer. Fortunately, a large fraction of prostate cancer, the disease is dormant, means the patient lives at least for 5 years, 6 years, 10 years. Now, the most important question in front of a caregiver, in front of a treating physician and a patient, is how to put these therapies one after the other, so that you can increase the longevity. No doubt, the longevity is going to increase. But as mentioned by the earlier speaker, the quality of life. I also mentioned about the quality of life is very important, because these patients are elderly patients. They have already facing the challenges of the old age. On that, you are putting them the burden of undergoing a hormone deprivation, that is androgen deprivation, which again causes simple things like losing muscle mass, make them
Mm.
weaker. There is a tendency of increased fall, which leads to fractures. So we have to educate through all these groups what things to be done, what things not to be done. In a patient of prostate cancer, a simple fall can make a patient bedridden. That patient may survive for 5 years, but there is no quality of life. So these things, how to know how to take a walk, help of. Though there are some patients, I have two patients who are hellbound on not using the walk. They are in their 90s. They are undergoing prostate cancer treatment since last 5 years, but they don't want to take walker. Then educate them with the help of other people. Here it is important to show them what happens to a patient who had fracture and bedridden. Here you should show that he is surviving, but he is not able to walk. The quality of life. So these things through a support group, they do understand from a person who suffers from it, rather than treating physician. So I think these support groups are very, very important. But at the same time, you need to have a check on them. They should propagate a science rather than propagating something as an alternative therapy. It is very, very important in our society.
Thanks, Dr. Bhosle, for these insights onto that. Moving ahead to the discussion to Dr. Fahad, in your experience, I would like to ask what are the most common barriers that prevent men from seeking screening for prostate cancer and how we can overcome from such obstacles?
So there are several barriers that can hinder the screening for prostate cancer in India. First and foremost is the lack of awareness. It's a very simple barrier. Most men are unaware what is prostate cancer and why early detection is important. And the solution for that is organizing educational campaigns that give us very clear, simple information to the public about what prostate cancer is, what is the risk, what are the benefits of screening by social media, by community events, etc. Second is the cultural stigma, because sexual function should also be discussed, and that can be a taboo while propagating this in the general health. We should foster open discussions about prostate cancer in community forums, involving the local leaders, the local corporators, and all, so that they will be able to reach far into the society and tell about, and normalize these discussions. Then another problem is the fear of diagnosis. So many men do not get themselves screened because they fear that they will be diagnosed with cancer. So in such a scenario, providing them counseling that early detection can actually lead to better outcomes will help them overcome this fear of diagnosis, and will be able to identify these patients at an early stage. Also, some people have this perception of being in a low risk category just because there is no family history of prostate cancer. So they're educating them that family history is not the only risk factor, and the age alone is also a risk factor to develop prostate cancer, will also help them overcome the barrier of screening. And cost concerns in India, I think it's a very major barrier. As rightly said by the previous speaker, the financial burden of the screening test and all can hamper especially the low income communities. So in such situations, advocating for affordable screening options, partnering with NGOs to subsidize the cost of PSA testing or scan testings can help. And also, now that the retirement age is gradually going high, we see more elderlies who are engaged in full-time employment, and their busy schedule from their work, the business, may prevent them from prioritizing their health over their work. So with if these barriers are overcome, then I think prostate cancer awareness scenario will be better in India.
Thanks, Dr. Fahad, for telling us about the common barriers that prevent men from the screening. Moving ahead to the discussion to Colonel Ajay, I would like to ask how can healthcare system better integrate policies that promote equitable access to prostate cancer diagnosis and treatment to all the demographic regions? Colonel, you are on mute. Can you please unmute your mic?
Yeah, this is a very wide range question and a very important one too. Universal healthcare or equitable healthcare is a big question mark in India still. But with Ayushman Bharat, Delhi Arogya Kosh, and each state having their own medical policies, we are making baby steps. But yes, that's an important thing. So, what needs to be integrated into such type of equitable healthcare is the affordability, the accessibility, the awareness, the infrastructure. All they like multifaceted, like all my previous panelists have said. So all these things once integrated can only afford this equitable type of policy decisions to be taken. So first and foremost is universal screening for all. Easier said than done. One should have this policy included in normal checkup also, medical checkup. Once a person goes to a primary health center, so भाई आपका क्या क्या problem है? Let's check your prostate also. It should be there in that public domain, rather that primary health care checkup. It should be there. Then you should have mobile health clinics where remote areas people doctors can't have access, or these phcs are not there, or you know workers can't reach. Have a mobile one, let them go and search out such people, remote areas, and do their checkups. And they should be all government sponsored. They can include ngos like us also. We'll be more than thankful to help the government. Then it is a costly thing. So it should be either free or highly subsidized. People should not be paying too much from their pocket to get themselves checked. Public private partnership, like I said, NGO should be involved. So can the private corporates also be involved. Then community health worker engagement is very important. Like I have already covered, previous speakers have also covered ASHA workers, then community health workers, they should be trained and well armed to check up such elderly people more than 50 years old. Now they say more than 80 years old. So they should be able to check them out. The training is very important. Then health education, I won't touch upon it. Already Dr. Santosh has touched adequately on this. So health education and awareness campaigns are a must. I have also covered that earlier. Capacity building, special training of physicians. Like somebody, I'm forgetting who was mentioning about the family physicians. I think Dr. Bhosle. So it's a very important thing which we at one time we had. I remember when I was small, my for any problem or anybody in the family, we had one Dr. Das. So we all used to go to Dr. Das, and he knew the entire history of the entire family, teen generations. So he could easily, just by checking the pulse and checking the liver and all, tell isko ye problem hai, isko ye karna, wo karna. So this concept is very important. Rather than just reading the board, who's specialized doctor, who's super specialist. So that family doctor, family physician concept must come. It is there in a lot of advanced countries also. Then equitable allocation of healthcare resources. Again, easier said than done. The government hospitals cannot match up with the private hospitals, at least in India, and for a very long time they won't be able to catch up. But still, allocation of funds, all these Ayushman Bharat projects and all, they are trying to do it, and I think slowly and steadily will catch up. Then health policy and regulatory reforms, that is at the government level, highest level. So that advocacy has to be there, and we must leverage the technology. Like Indian Cancer Society, somebody was saying about support groups. So we have patient support groups. Authentic information is available on our mobile app. It is in 5 languages, covering the major cancers, and we have got an e-learning program also online. People can access that. Our patient support group, people are literate. That is also in English and Hindi. And we have a faculty development program that is for higher level, for the faculties of the universities and the schools. So such awareness program combined with genuine information about cancer, the patient support groups get empowered. Then addressing the disparities in treatment, this is also a step which has to be taken. There are a lot of disparities, and you know, in India, a lot of people will go to non-MBBS doctors also. So something has to be told to them. अच्छा इसमें ऐसा है. They should be made aware कि भाई अच्छा इसमें we can only treat up to this much. Now from here on, please go to a specialized doctor who is a specialist in prostate cancer. So this alternate treatment and religious treatment and this healing touch and all these things will continue and for a very long time. And since ages back, it has been going on. But there has to be an effort to tell them कि भैया आप you go to proper hospitals. So I think this is what I had to say about the healthcare system, how policy should be evolved. Thank you.
Thanks, Colonel Ajay, for providing us with the policies. Moving ahead to discussion to Dr. Santosh, I would like to ask what are some common myths about prostate cancer that hinder effective patient care and how they can be debunked?
So I think many of patients, even the most educated people, even after learning from internet, even the advanced AI nowadays, we are seeing artificial intelligence providing the answers. In spite of that, it would not give a human touch and how to move ahead. So it gives you the option one, two, three, four. So what choosing is what is the role of the physician or the oncologist here. So no way the artificial intelligence can replace the human touch. So few common myths I come across seeing my patients is the diagnosis of cancer a virtual death sentence? It's not. So prostate cancer is a chronic disease. So no need to be worried of with the advancement of the medication. We can control it. It is now like chronic disease like diabetes, hypertension, where with medication the patient might even live easily beyond 10 years and all. The second most common thing is it contagious, sir? Is the prostate cancer contagious? If I use a common toilet in the hospital, if a prostate cancer have used the washroom, will I get it? Because it's in the urinary passage. So it's very clear it's not at all contagious. So many people in their home, if anybody has prostate cancer, they do not use the same washroom used by the patient with prostate cancer. This is commonly a myth that is seen. We have to debunk this myth that it is not contagious. And the next thing is this every patient of prostate cancer require chemotherapy. Many people will run away with the word chemotherapy. The most curable, most treatable cases of prostate cancer, because somebody would tell them that it requires chemotherapy, then they run away. Many prostate cancer does not require any chemotherapy. Simple hormonal manipulation nowadays. We have few tablets also that can easily manipulate without injections or any surgery. So this is another myth. So few other people ask in stage 4 cancer, if the disease is not cured, why should I take treatment? So the important thing is the control of disease, increasing the survival and improving the quality of life are also very, very important apart from cure alone. As we have seen with chronic diseases in the form of diabetes, hypertension, heart disease, and also renal disease, those are not curable. So we take the medication for diabetes, hypertension so that we control the disease and we manage the disease. So it's the same way prostate is a chronic disease where with medications and with some occasional injections and fewer therapies, we can control and increase the longevity with good quality of life, and the patient can involve in their normal social, economic, physical, or family life and everything. The other thing that many people ask is uh, PSA, sir, it is elevated as I've touched prior. Is it always because of prostate cancer? No, PSA elevation might be occurring because of other causes also. It's not always prostate cancer. Other people, on the contrary, sir, if I take this hormonal therapy, will I become feminine? And all I would be anxious all seeing at me. So the hormonal therapy, yes, it decreases testosterone, but it does not cause overt features of feminine, and they should not be worried of. And the most important thing is with good qualified treatment and not relying more on artificial intelligence on this one. Meeting a physician one to one, where it gives the human touch and the emotional aspect of the care is very, very important, which is lacking in many scenarios. And also, with the increasing requirement of time and engagement, there should be a new class of healthcare in the form of nurse assistant or physician assistant who would be there to debunk all these myths so that the proper decisions would come to the oncologist where he can give quality time for good clinical decisions.
Thanks, Dr. Santosh, for such an insightful information on the myths related to prostate cancer and how to debunk them. Moving ahead with the discussion to Dr. Sainath, I would like to ask what are some of the examples of disparities in prostate cancer care across different communities and what targeted interventions can help bridge such gaps?
So, the major disparities among the communities, if I have to frame it under three broad categories, one is the social, second is the economic, and third is the logistics. So, if I have to tell about the social barriers or disparities which we see, it's mostly about the perception of the disease and the fear of the treatment, which was adequately addressed by the other speakers in the previous questions. The fear of the disease, the fear of the treatment, the fear of the outcomes. So this leads to a lot of disparities, and it can vary accordingly to the educational background of the patients. And in India, I mean, there is a very common saying in Telugu as well, that ill health should be discussed in community. So you get a lot of free advice from a lot of the relatives, from the community, about saying a lot of myths about cancer care, and that actually creates a barrier for the patient to take the right treatment at right time. So today itself, I saw a patient who had defaulted treatment because of the fear which the family relatives have given them. And the patient unfortunately has progressed from a stage 3, which was a curable stage. Now he has become a stage 4 because he did not take the treatment. Now, coming to the economic barriers, we have a very different approach in our country. The costlier the treatment, the better. and because of which the patient always tend to use up all his financial resources for the initial part of the treatment or diagnostics, and thereby he's left with very limited financial resources to take the treatment throughout the course of the illness. So the most important is when we discuss with the patient, see, this is how the disease course is going to be, and your best outcome would be if you are able to take all the drugs available for this treatment, and how we are going to sequence it, and what are the uh, financial resources you need. So it's not always that the costlier the treatment, the better it is. There are always equally effective, albeit with some minor side effects, the treatments which are available for prostate cancer patients. So one should always be, not every prostate cancer requires a robotic surgery, not every prostate cancer patient requires a proton beam therapy. So even the conventional ones can be given with the decent equal efficacy and as well as limited side effects. Now, coming third to the logistics, lot of times because of the distance from the cancer center or the place where the patient can take treatment, due to the logistic reasons and personal reasons, patients are reluctant to travel far for the treatment. In such case, I think we can technology will help us. And like Dr. Bharat, I think he mentioned about the family physician concept. So if you can develop those professional relationships with the primary care physicians, lot of times the care can be delivered at the local place as well. And technology, obviously, we have now the government of India has also gone for telemedicine consultation, where you do the initial workup and initial assessment in the hospital, and subsequent follow-up can be done in telemedicine. Thereby, you see that there is no disparity in the continuum of care. And the fourth most important, which I never said, I did not mention, but I definitely want to mention, is the social media and the internet. We, this era of physicians face a unique challenge of misinformation, which is available online. So if you actually Google any of the cancer symptoms or cancer treatments, lot of misinformation pops up upfront rather than the right treatment. So addressing the misinformation also is a big challenge, and it needs to be addressed. And that is actually leading to disparities in treatment across all social, economic, and logistic spectrums.
Thank you, Dr. Sainath, for explaining it this insightful information. Moving ahead with the discussion to Dr. Bharat, I would like to ask what are the some emerging trends in prostate cancer treatment and support that could transform patient care in the near future? Dr. Bharat, please unmute your mic.
Sorry. So prostate cancer, we have seen a lot of innovations coming up in last 10 years. See, I would like to include those are diagnostics. So molecular, Dr. Sainath and Dr. Santosh had mentioned that diagnostics have improved a lot. See, what is important, all these things comes in our country. We have to see what is happening in our country. Number of geriatric patients are increasing. Now, policymakers have to understand the number of patients are increasing. If you apply something like a testing, it will have an impact on the number of tests, invasive tests are to be done. So simple rise in PSA most of the time is because of infection. So education of the society, the caregiver and all this support groups is very, very important, right? And going to the right doctor is very, very important right from the beginning before diagnosis happens. So neurosurgeons are the people along with the radiologist, intervention radiologist who do the correct way. The procedure also has to be correct. The prostate biopsies are not as simple as the other biopsies. It has to be obtained from both the lobes. Proper number of course has to be taken to the right pathologist who is going to be a high volume pathologist. He need to report in a proper way, looking at the grade, the percentage of the tumor. Why it is important? It will give us a conventional score. Now, when I'm talking about a molecular thing, which is from the Western country, we need to understand every patient or a person in Western country is ensured. He doesn't have to pay from his or her pocket. In India, a simple PSA test can lead to a battery of investigation which can cost lakhs of rupees. So the awareness has to start from there. Unfortunately, The good laboratories have no network which has reached, but the person has to reach to the proper doctor, proper laboratory, proper intervention person, proper pathologist. That is very important. Social media is very important. Along with that, with the kind of virtual consultations, people are not now able to know approach a person who is sitting in metros. A rural person is also going to know approach through, but obviously that physical touch or personal interaction is very, very important. So that is pre-diagnostic things, very important. One has to understand, rather than rushing for the things, to take a right decision. It is better to take time and go to a right person rather than no taking decisions in hurry is very important. A lot of molecular things are helping us to decide the tempo of the disease. Sometimes a prostate cancer which is diagnosed, which is very low grade, you don't need to treat it even with the surgery. If it is very low grade, group 1, we call it as a grade 3+3 Gleason score. PSA is very slowly growing. Because if suppose the patient is 90-year or 85-year-old, lot of comorbidities, and at that age, his normal chances of going beyond 5 years is very less. You don't need to treat that disease. That is again the second important point. That is after diagnosis. So molecular tests are helping us to decide what is the tempo of the disease. Now going beyond that, then you decide whether it's a very early stage cancer, whether you need to do surgical intervention to remove the prostate or apply radiation. Innovations are happening in every field. Robotic surgery are now largely replacing the conventional surgeries because it reduces the chance of number of days patient stays in the hospital. Quality of life improves. So I am not a surgeon, so I will not talk a lot about the surgeries. Radiation in the same way. There are newer ways, precise techniques of delivering radiations are coming up. So things are happening in surgery as well as in radiation. For advanced stage disease, we used to refer all the patients to surgeons for orchidectomy. Patients can choose not to undergo orchidectomy because, as there is a social stigma and mental stress, anxiety can be induced by these kind of surgeries where both the testicles are removed, which is irreversible surgery. It's not a reversible surgery. So patient can opt for newer preparations of suppressing the source of testosterone. So things are improving become better there also. Now beyond this, like there are newer anti-androgen therapies. There are 4 or 5 newer anti-androgen therapies are available to the patients with different side effect profiles based on the comorbidities of the patient, based on the patient's own problem, because geriatric age group it has its own problem. Patient has an option of choosing various oral drugs. Then coming to the chemotherapy, as my colleagues mentioned, chemotherapy का नाम लेती है सब भाग जाती है, but it's not like that. The way we deliver chemotherapy is very, very safe. We get an opportunity to see the patient repeatedly and counsel them that this disease is not something which going to progress within few months. These patients do live for years, but then they have to understand there are various treatment options which you need to place A after B after C after D, and that is how you have to utilize these options. Beyond these anti-androgens and chemotherapy, now the field has advanced in terms of radionuclide therapies. There are lutetium therapies, there are radium therapies, which also showed that there is a significant improvement, clinical improvement in terms of survival and quality of life. Beyond this, research is going on targeted therapies, immunotherapies. I will talk a little bit about this. There are some prostate cancer which are driven by genetic mutations in a particular gene, which is also responsible for breast cancer. So if that particular gene is detected, you have an option of going on a combination of oral targeted therapies. Some of the very, very few patients can have some aberrations, instabilities where these patients can get benefit from, obviously very short numbers from immunotherapy. So many research is also going on. Now why this research is important? These patients live long, right? And now India, fortunately, the research is also clinical trials. We call it as clinical trials are being done. So the patient needs to have information about these options as well, because in India there is a stigma that research means it's something is tried and they will not get benefit out of it. So to tell you the fact that it's not all about only money. These are the drugs. Once they clear out the clinical trials, these drugs are outside the reach of most of these patients. These will be launched at the lakhs of rupees for one dose, and then it is very difficult to tell the patient to buy this medication. In a clinical trial, especially in the phase 3 trial, there are promising molecules which can be accessed by our patients, at least some fraction of some patients. And these innovations come into market after 5 years or 10 years, and they are very effective. So this is very, very important. Newer therapies, this is not effective in prostate cancer, but the research is going on. These are specific immunotherapies, CAR T therapies in various solid tumors. These are happening at the research stage, but these are the treatments of tomorrow's, which are tried in the clinical trial. And you see these patients who are treated 10 years back are treated in the clinical trial are cured, and they are completely normal today. So one has to spread this word through the support groups that participating in a clinical trial is the best way to go to have access to newer innovations. So in prostate cancer, I see I was treating prostate cancer when there was hardly, docetaxel was the only molecule which has come up new. And now there are plethora of options of treatment. One has to understand this, discuss with their caregiver as well as the treating physician, surgeon, and radiation oncologist, as well as the counselor, and choose the right therapy based on their comorbidities. This is very, very important.
Thanks, Dr. Bhosle, for telling us about the latest advancement in terms of prostate cancer. I think due to some technical issue, Dr. Fahad has got disconnected. So, in the end, to conclude, I would like to ask Colonel Ajay, like, what role do the patient advocacy organization, or I would say Indian Cancer Society, play in shaping policies and practices for cancer care, and how their impact can be maximized?
Okay, I'll be very quick in answering this as we are running out of time. So, we can advocate policy changes only by collaborating with good NGOs and world organizations. We are partnering the National Cancer Grid in India and Union of International Cancer Control in Geneva and such like organizations wherein our voice can be heard. So now coming to what ICS is doing, very briefly, I'll just cover. We are doing cancer awareness and education. We run screening programs. We give financial assistance for treatment of cancer patients. We have emotional and psychological support units. We have rehabilitation services in which we have patient support groups, which I have already covered, and authentic information through our mobile app and electronic means. Then we have got patient navigation systems in place in at least in Delhi for 13 hospitals, where a patient coming, which counter to go, how to navigate, and how to get the best treatment, how to get financial assistance from other than ICS, that is Indian Cancer Society, from the government. All those patient navigators we have. Then we are very soon going to start home care services for palliative treatment, but that is still on board. Then we have got advocacy and policy, like I said, through other NGOs and world organizations. Our chairperson and honorary secretaries, they are called to the Rajya Sabha for consultations for cancer control. Then we have got volunteer programs wherein students, teachers, normal people, they come and volunteer with us. They do internship and take the word of cancer control ahead. We have got caregiver training, very important aspect which so many doctors have acknowledged, that caregiver is also an integral part of the multifaceted treatment of any patient. Thank you.
Thanks, Colonel Ajay, for such insights. In conclusion, our objective for today's panel discussion was to explore and emphasize the importance of holistic prostate cancer care by integrating physical, emotional, and psychological support. And I'm confident that our esteemed panelists have addressed this topic comprehensively and very effectively. I would like to extend my gratitude to each of our panelists for their insightful contribution and for sharing their expertise with us. Thank you so much, everyone, for joining us and to contributed this important discussion. Thank you so much.
Thank you. Thank you very much.
Thank you. Thank you. Thank you. Thank you.